What is going on, everyone? This is Dr. Josh Funk, and you are listening to the Strength and Knowledge Podcast.
Good morning, everybody. This is Dr. Zach Baker of Rehab to Perform, Program Director for the R2P Sports Residency. And I have with me today Dr. Seth Hawks, who is one of our 2 sports residents, and this is his first time on the show doing one of our many upcoming monthly research article reviews. Seth, welcome to the show.
Yeah, thanks for having me.
So we had Abby on here recently, and she talked a little bit about altered loading mechanics with ACL repair versus ACL reconstruction. We are sticking with the theme of the knee. Do you mind giving the listeners the title of the article that you chose and just a little background on why you chose it?
So the article I chose is Increased Patellar Tendon Microcirculation and Reduction of Tendon Stiffness Following Knee Extension Eccentric Exercises. This one kind of stuck out to me because I've had a pretty big influx of patellar tendinopathy patients lately. I've noticed that even throughout the entire clinic in Frederick, we've seen a little more of it. So just something that kind of caught my eye and wanted to look more into. We've always been told why eccentrics are good for stuff like that, but more of how, like what is it that's causing it to be the better option?
Definitely. I think tendinopathy, whether it's patellar, Achilles, or any part of the body, is something, if you work in an outpatient clinic, you are going to have somebody come in with that at a pretty high rate. In Frederick, we have a large youth, adolescent, and college population. We also have a large active adult population, primarily in the endurance sports athletes. So we see a lot of runners, we see a lot of cyclists, we see a lot of people who just recreationally like to get outside. They like to hike, they like to walk. As the weather changes and it gets better, they tend to find themselves more active. Changing activity and changing volume of activity tends to be 2 things that make tendinopathy really spike and really become more present. So I was excited when you picked this article and when you sent it my way because, like you had mentioned, I feel like a lot of times with tendinopathy, we kind of blindly know what to do in regards to, all right, we got to manage symptoms, we got to give them progressive resistance exercises, we're probably giving them some degree of isometrics or eccentrics, but it's always nice to know the why. And, it's nice to know that medicine works. It's better to know how it works. Same thing with exercise prescription. It's nice to know that exercise is going to be beneficial, but it's really good if you can articulate why and how it's going to be beneficial and how much exercise is needed for that benefit to occur. With this article, do you mind going a little bit into detail in regards to who was involved in the study, what they were looking at, and how they were looking at that?
Yeah, so the population they used, it was 14 healthy college students that didn't have really a history of being in sports training, and they weren't the most active people. And then it was 25 students that were part of the tennis team at National Taiwan University that were undergoing that professional tennis training at that time. And so some of the things that they were looking for, like with that non-athlete college student, they were only exercising at a self-chosen intensity. They weren't having any programming at all. They're wanting their physical exertion to typically be around that 12 to 14 on the Borg scale. And then with the tennis athletes, they had to be undergoing that professional tennis training with the university at that time, participate in singles match play at least twice a week, averaging a heart rate of give or take 161. And then their rate of physical exertion after the match play was supposed to be 15 to 17 on that Borg scale. And they wanted to make sure that none of the subjects involved had a history of knee, leg, or ankle pain in the past year, that they've reached out for medical help. They have no disease or use of medications through that past year that could interfere with microcirculation, and also positive signs of local swelling, neurovascularization in that patellar tendon on their dominant side.
Cool. So it sounds like we have a pretty clear-cut athletic and relatively non-athletic population. And with each of them, the athletic group, they had some criteria to make sure that they had structured physical exertion levels, volumes, and intensities in place. So big picture, we have trained individuals. On the other side of the scale, for the quote-unquote non-athletes, these were people that were just exercising at a relatively sporadic and self-chosen frequency without any specific structure to them. Now, with this article, it looks like the two things that they were looking at microcirculation, which I believe they were monitoring via O2 sat and hemoglobin levels within the tissue. And they were also looking at tendon stiffness, which they were using ultrasound to actually look at fiber length with that. Do you mind going into a little bit of detail of when they were doing their knee extension eccentric exercise training, what were the parameters in place with that? How were they actually doing these eccentric exercises?
The entire test took place on the biodex. So they were keeping them within a 30 to 90 degree range of motion during it. They split the tennis players into two groups. One group of 12 was assigned 4 sets of 40 repetitions. The other group of tennis players was assigned 4 sets of 80 repetitions. And the non-athletes were in a single group, and they were with the 4 sets of 40 repetitions.
Perfect. So we got biodex. We got some volume, 4 sets of 40, 4 sets of 80, operating within that 30 to 90 degrees. And really what we're looking for now with this is, are we having any changes in microcirculation, and are we having any changes in tendon stiffness? $1 million question, Seth. What did they actually find?
So after going through everything, the tennis group that did the 4x40, they did have significantly greater O2 sat with the microcirculation, but they did not have a significant difference in their total hemoglobin. The 4x80 group for the tennis players, they had a significantly greater O2 sat and hemoglobin. And in the non-athlete group, they also had significantly greater O2 sat and hemoglobin.
And with the non-athlete group, that was at the 4x40
correct
set and rep range. So, and then it looks like when we get to tendon stiffness, we have very similar results. With the tennis group, the 4x40 group did not have a significant reduction in tendon stiffness, but when they bumped up to 4x80 set rep range, that was when they did get a significant reduction in tendon stiffness. The non-athletic group, the 4x40 set and rep range was enough to provide significant reduction in tendon stiffness. So when we look at the results of this, it looks like for the untrained non-athletic group, 4x40 set and rep range was enough to elicit positive tendon stiffness changes and microcirculation changes. When we looked at the tennis group that had a training background and a training experience, we did not see significant changes until we went from 4x40 up to that 4x80 group. So with me, the big thing that I take away is training age, training experience, and training exposure is going to have a direct correlation on the amount of stimulus you need to provide for your individual to get beneficial changes. And this is confirmed at now a histological level with this, which is always nice to see. Stuff that we know, hey, if you work out, you have to work out at that rate or a little bit higher to see changes. We have confirmation here from a level of fiber length changes, but also microcirculation that's happening there. And I think that's important to note. The other thing that's important to note is this goes both ways. If you have somebody that has a high training age and experience, you need to load them a little bit more so that they get additional positive outcomes. But if you have somebody that has no training background, you just need to do something with them. We don't need to reinvent the wheel and come up with, a crazy exercise program where we're looking at, drop sets and cluster sets and supersets. We just need to give them a standard, structured, eccentric training program, and they're going to respond to some degree. Then they're going to acclimate to it, and we'll eventually have to increase, but we just need to start somewhere with them. Seth, going through this article, were there any surprises to you, or was it pretty much confirming thoughts that you had? And then really my question for you is, how do you find this influencing your patient interactions in the clinic, either with what you're doing or what you're doing from an educational standpoint?
So the results weren't super surprising to me. We've all kind of have that idea of you have to give a proper stimulus for you to get a reaction. And so someone that is higher trained, obviously you're going to have to provide a little more stimulus. When it comes to like utilizing this in the clinic, I definitely have a few patients that are that higher level athlete, even at a young age. I have a few early teenagers that are competing at state level with triathlons, things like that. So they need to be pushed pretty hard. But I also have my few that they just started getting into sports. They're at that age where they're hitting growth spurts, causing a lot of things involved with patellar tendinopathies, and they don't fully have the strength or the background to where it would be necessary to push them as hard. And seeing the results in this, I can now see that I don't have to push them that hard to get a proper result for them.
And I think, we keep talking about we need to have the appropriate level of stimulus, the appropriate level of training intensity and volume for them. We do not know that unless we get a background and a history on what they're currently doing. So I think all of this comes down to proper program design. The first step to that is knowing what is their program currently already entailing. What are they doing within their current, macro or micro cycle of their training, and how long have they been training leading up to this? And during an evaluation, we need to make sure that we're doing our due diligence before we even get into the objective testing and looking at their current tolerance and capacity with activities. We need to get some background information of what does your training regimen look like? All right, so you say you're a runner, you say you're a triathlon, or you're a high school track runner or a high school tennis player, whatever their activity may be. We need to get a snapshot of what does their current weekly, monthly, physical activity schedule look like. Once we get a good picture of that, how is your current injury influencing this? Are you able to continue to participate at those levels? You're just having discomfort with it? Or has this level of discomfort and impairment prevented you from participating? That's important because then we know what are they doing outside of the clinic, and is what we're doing inside of the clinic supplementing that or replacing that? And that's a very important thing to know. We also need to know, leading up to this injury, what did training look like? Have you been relatively stable and consistent for several months or several years? Or have we had an acute spike and change in activity level where, yes, exercise is going to be an important piece of that, but maybe additional education in regards to what does a good training program look like with regards to consistency in season and off season. So, Seth, as always, I appreciate you and previous residents before you doing the legwork and doing the dirty work on this. This will be the first of many times we hear from you over the course of the residency on our monthly research article journal review. Seth, thanks for coming on.
Thank you.
Thank you for listening to the Strength and Knowledge Podcast. If you enjoyed this episode or have been tuned in for multiple episodes, we would love for you to subscribe, rate, and give us a review on Apple Podcast or Spotify. Until next time, thanks for listening.